All right, good morning. It is good to see you. It's actually a new day, a new week, and a new month. It's the 1st of April, 2019. I hope you have not been fooled like I have, but if you haven't, then probably you might think about fooling someone before 12 p.m. But all the same, I hope you're well. Thank you very much for making time for us right here on My Doctor. My name is Winnie Lubembe. Now, occasional anxiety is an expected part of life, but you might feel anxious when faced with a problem at work, when you're about to take a test, or when you are about to make that important decision in life. But anxiety disorders involve more than temporary worry or fear. And for a person with an anxiety disorder, of course, the anxiety does not go away and can get worse over time. But with treatment, many people can manage those feelings and get back to a fulfilling life. So what is it exactly about anxiety disorder, and what really translates into an anxiety disorder? Not just a normal anxiety. Well, we have that and much more on our show today, so you do not want to miss any part of the discussion. Stick around till the end of the show. But just in case you have any other question, 0791-478-990 is the number to call in live, or alternatively send us a text message on 40975 with your name and of course your question, and we'll answer it as soon as we get it. But for now, let me introduce my guest for today. Good morning, Arthur.
Good morning.
Have you been fooled yet?
Yes, yes, very early in the morning. I think at 12:01.
Oh my God.
I got a call, yes.
That's so wrong. So wrong. I think we should get back and fool the people who pulled this.
We can plan that.
We should.
Yes.
All right, but all the same, thank you so much for coming by. Today, kindly introduce yourself.
Okay, thank you for having me. My name is Arthur Muriuki. I'm a psychologist in private practice on Peponi Road in Westlands.
All right. Now, when we talk about anxiety, and this is something that we encounter day in, day out. But now, when does it translate into a disorder? So what differentiates between just the normal, feeling of anxiety and fear and a disorder?
Okay, so I like that you've brought in a different word, fear. Maybe you can begin by defining what anxiety is.
Okay.
When we look at anxiety, we refer to anxiety as a secondary emotion, with the primary emotion being fear. And how we define fear is dreading is a response to something that is threatening you right now.
Okay.
But when you look at anxiety, anxiety is an anticipation of a future threat or a future response of fear. So with fear, the event is happening right now that is threatening you. And it could be something very mild to something very severe. But anxiety is a dreading of an event that has not yet happened. So there is a primary emotion that is fear, and then a secondary emotion that is anxiety.
Anxiety, okay.
So I like how you've begun by explaining what anxiety is, because it's correct. So anxiety is a normal human emotion.
Yeah.
It's a healthy emotion experienced by human beings the world over, and animals too. So there's good anxiety, and there's, or maybe what you can say, there's healthy anxiety and there's unhealthy anxiety.
Okay.
So healthy anxiety is what you call the, on the spectrum of anxiety, or the continuum of anxiety, is anxiety that is mild, that is manageable, that you can manage with. For example, if you have an interview coming up tomorrow and you don't know how you might perform, it's a job you really want, so you get a bit apprehensive, and that kind of apprehension causes you to go read widely and prepare, read about the company. And then you're able to show up tomorrow morning and sit through your interview and hopefully even impress your interviewer.
The interviewers, yeah.
Now, when it crosses over to distressing levels, so that it affects your ability to function, then now it starts entering into the realm of an anxiety disorder.
Okay.
And how we look at whether the anxiety you're feeling is normal or healthy anxiety versus abnormal and unhealthy anxiety is to look at the intensity of this distress. How debilitating or how heavy is it for you? So you look at intensity. You also look at frequency. How often do you feel like these very intense emotions of fear or anxiety? And then we also look at the, so I've mentioned frequency, intensity, and then duration. When you start feeling this anxiety, how long does it persist for?
Okay.
So if all these answers you're answering in the red, then we start looking at assessing you for an anxiety disorder. And there are many which we can talk about.
Okay.
later.
All right. Now, for fear, there's that aspect of, flight or fright.
Yes.
But now for anxiety, how does that happen? And then in terms of, someone might argue and say, but we're different.
Yes.
In terms of how I might manage my, levels of anxiety might be different from the other person in terms of how we're able to either tolerate or, manage them. So how does it get to that point where we're like, this is more into the disorder part, especially with the earlier signs and symptoms? Yeah.
So you've again brought in a good context about flight or fight. So what those two terms mean, flight is when you're threatened, there's an immediate threat, you take off to save your life. And this is, and the second one, a fight, is when there's an immediate threat, you want to fight to save yourself. And these two responses are automatic. You're not given, the brain does not give you a chance to think through this threat. Will it harm me? Will it? So it's happening right now, and I take off. And that's normal as an adaptive mechanism for the body to survive the environment. So that's normal and healthy. Then we have this other realm of anxiety where the same mechanism in the brain is activated, and yet there is no immediate threat. Remember how I define anxiety is anticipating a future experience of fear or a threat in the future. So these false alarms, the same autonomic response is reactivated in the brain, and yet there is nothing in your immediate environment that is threatening. For example, if a child was to maybe steal some sugar in the house, and they know if mom or dad comes home and sees that they are reported, they're going to be in a lot of trouble. So they've not yet been reported. Mom and dad have not come home, but then they are so scared, they are dreading, it's a very heavy dread. If this so-and-so snitches on me, then I'm in a lot of trouble. So this child starts behaving as though the mom and dad is already home and they're already in trouble.
It's sort of like reenacting what will happen.
Yes.
Okay.
So it's a false alarm because the threat is not yet there. The threat has not yet come. But the body creates this experience internally that causes them to fear. The other aspect of anxiety is that it's a subjective feeling, meaning how I'll experience my anxiety is very different from yours. Maybe your anxiety is when you enter a room, and maybe when we talk about types, this will be more clear. When you enter a room, you're very scared of how will you get out. Okay? And someone else's anxiety, and for example, if it's a room like this, you're able to speak to people publicly. But you're worried about, should anything happen, how will I escape? And someone else will enter the same room, will not think about or worry about escaping, but will be too nervous to speak to people. So both of these people experience the same emotion, but it manifests differently. So it varies from one person to another, and a similar person will enter the same room and just go mute. Like will not be able to even say good morning. So every person experiences it differently, and because of the basic individual differences, that you're at the core very different from me in how you think, feel, and behave.
Okay. All right. Now let's tackle the types, because we understand, of course, they're different types and manifest or present themselves differently. So yeah, let's just start with the most common, and then of course translate to the others.
So maybe I can talk about what has that have been brought to attention most frequently, especially in the past 2 years. Is something called generalized anxiety disorder, or what people love to refer as GAD. And then there's a social anxiety disorder, or SAD. So with the first one, generalized anxiety disorder, just like the name says, is that you experience these false alarms more often than not. So that you're constantly or almost always nervous or anxious about something. And when that situation is resolved, or you get some support to resolve it, the anxiety shifts to something else. And it affects, it just like any other mental disorder, it affects your capacity to function. So that's the basic definition of a generalized anxiety disorder. And there is physiological or the way your body reacts to that, so that you're not able to sit still. you're losing your train of thought, you're getting butterflies in the stomach. Sometimes people get very severe tension headaches. They get very dry mouth. They're not able to speak. And then the thoughts sort of change to sustain that, so that they start saying, if I'm not able to speak, how are you thinking about me? You think I'm stupid. You think maybe I don't know what I'm talking about. So that's generalized anxiety disorder. When we cross over to the second most common one is social anxiety. Like the example I gave earlier, as long as you're with a group of people that is close to you, very intimate, like your family and your very close friends, you're able to interact openly with them.
And be like your authentic self.
Yes.
Okay.
But the minute you venture out of that comfort group, you cannot function. You're sweating heavily, you're very tense, and you just cannot function. If you're given a task that involves working as a group, then you will not achieve it. And it becomes a lot more complicated, especially if it's regarding to work or schoolwork. So that when the teacher looks at, or your parents look at your grades, they are continually on a down slope, and they cannot. You're a bright student. Any work that involves you're working on your own, like typing or reading and writing reports, you are an A student. But on tasks that require you to function together, you score poorly.
Okay.
So maybe I can give you an example to differentiate the two. For a lawyer who maybe has a case to plead in court, and they show up in the morning and they are very nervous. They're wondering, will I make sense to the judge when I start speaking? Will my client here think I know my content? Will they feel like, will they sue me now for malpractice? Am I able to express myself more eloquently? And will the judge reprimand me? So you see, they've started anticipating something in the future. It's not happened. The judge has not even walked into the courtroom. But they are so nervous they are not able to sit still. And they start sweating. Now, if you're sweating heavily and you stand to plead your case, you start being very conscious. Is my sweat?
Can
is
people
it?
see?
Yes.
Can people judge me?
So it affects your ability to function in that courtroom. So this thing you were fearing previously, will I be able to function? You end up not functioning. So it reaffirms that you just cannot function well in public. So you start avoiding going into those situations that will trigger these false alarms. And of course, if you're a lawyer and maybe your core duty is to go to court, and you're starting to avoid going to court, your employer might not find you very useful. So it will affect also now your career. So we are finding, and this is very sad, we are finding, especially the upcoming young lawyers, most of them now are choosing not to go to court, not because they're not very good at arguing out in court.
But that fear.
Yes, so they're choosing to work more behind the scenes and not go practice the thing that they actually went to law school to do. Their passion, yes.
All right. I have a question, and especially on generalized anxiety disorder. I know from what you said, of course, there's this unrealistic worry, or tension with little or no reason. But is this mostly directed to probably a particular thing? Because I know from the difference between, of course, that the generalized anxiety disorder and social anxiety disorder. Of course, these are two different cases. But are they mostly, let's say triggered? Yeah, I think triggered is the right word to use. Are they mostly triggered by a specific thing, or it's just in general, this person is anxious all the time?
So remember when I say that it's subjective feeling, fear. So how my generalized anxiety disorder might manifest in me would be very different from you. So that the things that cause me to be anxious could be a thought that keeps repeating itself in my head. And it's an automatic thought. It's a negative automatic thought that just comes and destabilizes me. But maybe for you, it's triggered by something that you actively worrying about. For example, maybe if we look at maybe your line of work. So let's say there's an event that has happened, or maybe you're a news anchor, and they count down until when you start speaking. And then when you start speaking, you're wondering, how am I dressed? Is it
Yeah.
what will people think of me when they see me on the screen? It's so you start dwelling on thoughts that are distracting you from what you actually want to do.
Okay.
And even when and you so before you go on live TV, you're worrying about these thoughts, and then you go on live TV and these thoughts sustain. They are sustained, and then the show is over. So the threat that you are fearing is over.
It's over, yeah.
And so that anxiety ends there.
Okay.
And then you think about the next thing. What about tomorrow's show?
Oh,
Okay,
wow.
so it's resolved, and then another thing comes. So it's a constant state of I am anxious, I am scared, I'm worried, and it continually affects your ability to function.
Okay.
So for most people who have anxiety, it doesn't mean that it's an anxiety disorder. So it has to meet that 3 criteria.
Yes.
Is it, how intense is it, and how frequent is it, and what's the duration? And is it affecting your ability to function? Most of us suffer low-level anxiety, which is normal and healthy. It causes you to plan and execute and meet your deadlines, which is healthy and normal. But then when it starts crossing over to places where it's beginning to affect how you function, and also you're avoiding people or events or places or triggers that again are affecting your ability to function in society, then we begin to get concerned that it could be an anxiety disorder.
All right. Earlier on, we had a question, and I know this person jumped in earlier on us, but of course, we'll talk about it later on, and that is on medication. And this is Chimtai from Eldoret, and she's asking, are there medications that she can take to counter anxiety?
Yes, we have very good medication, and the reason why I'll not mention this medication on air is for concern that it would make the listener think, oh, I can go get that pill and take, and then I can determine when I want to take it. For most patients who are also prescribed medication, a very strange thing happens that they say, I'll only take it when I'm anxious. So it becomes like an emergency drug. And what we always recommend, that if you feel, or if someone points out to you that there's something off, that they're noticing for example, now today's topic is anxiety, it helps to go talk to a professional. And in most cases, we recommend a psychiatrist who's going to assess those factors and also assess for need for medication. It's not all anxiety that require you to be put on medication.
Okay.
So psychiatrist is able to assess and determine and even have a genuine conversation with you. Would you consider this medication? And these are the side effects that you can expect. So for the viewer, I'd recommend that look for your closest psychiatrist and have this conversation with the doctor to see how would you get this kind of help. So there's very good treatment options for anxiety, and we can talk about them later. So there's hope. You do not have to constantly live in fear, and it doesn't have to be so intense that it affects your work.
All right, and I think that is a culture that most of us have, that, you notice something, you go to, let's say a pharmacy, gets, specific medication and take them. Don't self-medicate. All right, and of course we still have other types of anxiety disorders, and this I find it very interesting, and this is the panic disorder. We all panic at some point in time. Probably, like you said, it's different for different people. Some probably don't know how to manage, but now how does panic disorder come to play?
And that's true, that sometimes we may think of something or be put in situations that we start panicking. And for a large majority of the population, they are able to resolve that panic. So for example, you've left work late in the evening and you get to your door and you don't have your keys to the house, which is common. For most people, they start panicking. Where am I going to go? Am I going to break down this door? If I break down this door, how will I lock it when I get in? And tomorrow, will I have to pay for this cost? And some are able to have alternative thought patterns, that maybe I can go to my parents' home, or maybe I can call a friend and go spend the night there, and then look for options tomorrow. Or maybe I can call the caretaker, or I can call the landlord. So there are options that are made available to this person, and they resolve that panic, and they're able to think clearly. So that's healthy and normal. And so it resolves after a short period of time. So when you go to a panic disorder, same case, you show up to your door and you're not able to find your keys. And for you, that immediate environment causes you to worry severely, and the symptoms become so severe that you feel you are not even able to breathe. It's as though you're getting a panic attack, and you feel, you actually genuinely believe you're going to die. And that feeling does not resolve itself immediately. You start hyperventilating, and you can't even think clearly. Some people even faint. So that's, because you remember when I said the intensity, duration, and the frequency. So that's a distinct. So a panic, for you to be given that diagnosis of a panic disorder, remember, it comes and it persists and it's frequent. So that if it happens once and you panic and you're not able to think clearly, it doesn't mean that now, for the viewer listening, that they have a panic disorder. There's a specific criteria that, again, for my concerns about the viewer listening and saying, this is what I have, and then triggering the panic, I'd recommend that if you have experienced any of these symptoms, that more than once, and it's something that has genuinely made you feel that you're going to die, and it happens a lot more frequently in situations that you cannot explain, why am I reacting like this? And maybe if we have time later, we can talk about what is the genesis of all these panics. Why is it that the brain starts reacting with panic constantly?
Okay. All right. Of course, we need to take a very short break, but when we come back, there's also an aspect of phobia. And I wonder how the phobia now translates into being a disorder.
Yes.
On its own, because, we all have different phobias in general. But, of course, we'll also talk about, do people with this different anxiety disorders behave the same, or do they behave differently? And how do I know that I have a specific, anxiety disorder? So all of that coming right up after the short break. You do not want to miss any part of our discussion. But again, if you have any other question in relation to the same, then feel free to call us live. 0791-478990 is the number to call in live, or alternatively, if the lines are busy, send us a text message on 40975 and we'll answer your question as soon as we get it. We'll see you on the other side of the break. Stay with us. All right, welcome back. Glad you're still with us. This is My Doctor, and just in case you're tuning in right now, today we are focusing on anxiety disorders. And of course, before we went for break, we tackled, several types of anxiety disorders. And like I said, if you have any other question in relation to the same, feel free to call us live. 0791-478990 is the number to call in, or alternatively, send us a text message on 40975 with your question, and we'll answer them as soon as we get it. Now, before we went for break, of course, there's that aspect of phobia. Now, how does this now translate into an anxiety? Because, like I said, we all have different phobias. We manage them differently. And most of us, when we have a phobia to, let's say, a particular thing, we avoid it completely. Is that one of the ways that help us sort of to not translate into now becoming a disorder?
Yes. When we were listing the general symptoms of an anxiety disorder is when you become aware that these are the things that cause you to feel very bad internally, the natural response is to avoid. I don't want to talk about these things. I don't want to see images. For example, if your phobia is for snakes, which is very common,
yes.
And then maybe I say there's a snake under that seat that you're seated on.
Okay.
Yes, even there you've reacted.
Yes.
So I'm not saying you have a phobic. You need to be concerned about a phobia.
Yeah.
It's a normal reaction to a threat. And you see, for you did not jump out of your seat and leave and decide you're not coming back to the interview.
Okay.
So it's a healthy relationship with snakes, that you know that this is threatening, I'll keep away.
All right.
Now, if I had mentioned that there's a snake under your seat and you ran off and you decided I'm not coming back, what if there's a snake in that set? I mean, they've not hired someone to even check whether there are snakes on set. And then you decide you're not going to do it from here, you need to do it for a different set. So it's beginning to already get your your superiors to wonder, okay, is she okay? Do you need to get help for her? So for phobia, it's a situation where you constantly or repetitively worry about something that will affect you. And so that with the example I've given for the snakes, if you maybe live in a place where there are snakes, so most people will keep an eye out. I know I need to keep my doors locked and my windows, and if I have a young child, I need to constantly see if there could be in any danger. And, as a parent, but you know, if you have a phobia, even seeing images on TV, if there's a TV show, any TV show, and they show images of snakes, or there's a movie and there's a snake, you go into that state of, and so for some, actually, it becomes so severe that it triggers a panic attack. And you're all watching a movie and enjoying yourself, and then suddenly you start hyperventilating, and you can't breathe, and you start feeling like you're going to die, and everyone around you is wondering, what just happened?
What is happening? Yeah.
So there are those cues that will trigger your anxiety, and I have a similar anxiety, but those cues don't trigger mine. Something else triggers it.
Okay.
So for phobia is you are avoiding something so seriously that even conversations around it you do not want to have.
Okay.
So it's an aversion to, you do not want to have anything to do with that specific thing. That there are people who have phobia for lifts. I do not want. I do not want to get into a lift. I will use the stairs every time.
Okay.
And if the stairs are under construction and the only place to access your office is the lift, like I'm not going to work that day.
But does that, but does the avoiding part really help? Because at some point in time, of course, you would have to encounter that thing that you, of course, you have that phobia too. So does avoiding really help? But like, for instance, the example you've given of, lifts. And then there's a point where they're not. I mean, you have phobia for lifts. You use stairs, and then probably something is happening, and you cannot use the stairs. And so, what do you do? Like, do you decide not to go to work, or something like that? So, does it really help at the end of the day, or you better just face it?
Yes. We call these coping mechanisms. So, what do I feel in the moment I need to do to save myself? Remember, it's a false alarm. To get myself out of this situation. So any strategy you come up in the moment, some people will take off, some people will refuse. So completely, if that job requires me to get into that building and the only access is the stairs, even if there are 14 floors, I don't want it. So, and that's healthy for you in that moment because it keeps the trigger away. So that it doesn't reactivate the anxiety. However, we now when we begin to look at what are the healthy coping mechanisms. So some people will say, since I need this job and I have to face this fear, how can I do it and in a healthy way? So some will resort to alcohol. Let me at least be a bit tipsy so that when I get into that lift, I am not fully aware of what's happening. Or let me drink so that I can numb that fear. And in that moment, it makes sense to that person. But then we're looking at, is it a healthy coping mechanism or is it an unhealthy one? Could there be other, more healthier options? So yes, it helps to assist that person persevere or go through that intense period and come out on the other side. Because then if they forced themselves to go through that situation without a coping mechanism, they will end up on the other side, but they're in a very bad shape. So it's a normal and healthy reaction for you to consider an option that will help you go through that. Some people just close their eyes or they hold someone's hand, and the grip is so strong it feels like it's metallic. But it helps them to go through that period. There are people who have a phobia for dentists. So if I have a hurting tooth, I will not talk about it. I'll keep quiet because if I tell my parents, they're going to take me there. So it gets a lot. The infection continues, and it becomes such a big infection and affects the whole jaw, just because you dread. Now, if a parent doesn't know what these phobias are, the reaction to that will be very aggressive.
True.
Why didn't you tell me? Look at now what's happening to your mouth. And you're continuing to harm this child and forcing them to face these dentists. Now, I'm very happy to say that now that I've used the example of dentists, we have very well-trained dentists in Nairobi who recognize these phobias, and they incorporate strategies to calm these patients before they can access their mouth. So we have good work going on there.
Okay. All right. Now we have a question, and this one is so direct. This one says, "Habari doc, nateremeka sana." This is Akinyi from Nairobi. Just
Okay.
that, yeah.
So she hasn't said what's happening
exactly?
to her. I forgot to mention in the beginning that for any mental illness or disorders, before we go into making a diagnosis for it, we like to rule out any presence of a medical condition. There are some diseases or physical conditions that could mimic an anxiety, a mental illness. So for Akinyi, I would recommend that go to your GP first or to the closest doctor next to you to find out could there be something else going on. So it could be chills, it could be shivers, it could be something that has a disease component. So when that's taken care of, maybe ataacha kutetemeka. So that if after she gets a clean bill of health from her doctor, then now she can consider going to see a therapist or a psychiatrist to find out what is this thing she's defining as kutetemeka, and how long has it been going on, and in which situations does it trigger itself. So Akinyi, you do not have an anxiety disorder until it's confirmed.
It's confirmed. Okay. All right. Now, and all this, the different types of anxiety disorders that we talked about, of course, the biggest question is, where do they come from? Is it something to do with the genetics? Is it something to do with, let's say, a person's background or an experience? Or where exactly do they stem from?
For anything that touches on human behavior, we look at, I'm sure you've heard about this debate, nature-nurture debate. Did I come into this world genetically predisposed to get a mental disorder? Or did I come into this world healthy, but the environment changed my health? And my continued exposure to threats, to an unhealthy interaction style, to malnutrition, to trauma, did that hardwire me to constantly be anxious throughout? So at the genetic component, if there is a psychiatric history of mental illness in your family, and especially with the immediate family members, it predisposes you to that. So there's an inherited component. And there are some things that, and this is very important information for pregnant mothers, to evaluate how is the environment. So that, for example, there's a study that was done in 2013, I think it's 2013, that showed a link between the what you call in utero, the fetus in the womb, and the environment of the mom. So that anything that is happening on the outside has an impact on what's happening internally. And what the mother chooses to eat, to drink, how often she rests, the kind of stress she's under, the kind of noises that are under. And maybe I can give you a very simple example. If, for example, you're pregnant and your whole environment is chaotic, shouting and screaming and banging, and so it's very chaotic. You're an adult, you can probably handle it. You can expect it and know how to cope with it. And you can escape, you can leave that environment. But you see, the fetus is stuck there, cannot get out and run to look for peace. So anything that happens out there has an impact on this child. So when the brain is forming, the neurons hardwire themselves to expect this scenario, that every time there is quiet, there's a bang. Every time there's quiet, there's a bang. Every time I try to relax, there's a bang. So when this child is born, these are children that end up to be very difficult to soothe. So you're seeing this child is crying and is very uncomfortable, is tossing and turning, cannot sit still. You check their diaper, they're okay. You check their fever, you take them to hospital, your pediatrician says your child is okay. But when this child constantly cries for no reason. And this is because the brain was hardwired, expect a bang. And then when you get this child, you want to be quiet. Don't make noise to wake the baby. Don't do that.
Yeah.
So it's a very uncomfortable environment for the child. When is this bang coming? When is this bang coming?
Oh, so they learn to sort of expect all the time. Okay.
So a strange and a sad thing happens because when you get a child who's not very difficult to calm down, it begins to affect you, and you begin to ask yourself, am I a bad mom? Am I a bad parent? Why is this child not calming down? Why is it that they are not able to react to my soothing techniques? So, and people get frustrated. We've had mothers, we've heard of cases where the mother was so frustrated she threw the baby. I'm tired. And you see, if you notice that there's this child, a very strange thing happens. If there is noise in that room, the child calms down.
Yeah, and people would say my child will actually sleep when there is noise. Okay,
and
makes
it's
a lot
not
of sense
healthy.
now.
So there's that genetic predisposition, and then the environment that happened during the gestation period, and also when they were born. What was the environment around there? What kind of, was the mom taking alcohol? Was she using drugs? Was she severely stressed? So did she get an infection or a disease when she was pregnant? Was she taking medication that could have harmed the baby? So all these factors can predispose a child before they are born to being susceptible to, or not being able to in a healthy way cope with stressful environments. So that's in utero. So when the child is born, the kind of traumas, if you have a history of childhood trauma, if there was malnutrition, if there was your brain was not stimulated well enough, if you're kept indoors, if you not interact with children. So all these things that a child learns at an early age to cope with, if those things were denied from your environment, and then you're an adult and you're expected to know how to cope with these things, it causes anxiety. What do I do? What do I do? How do I think? How do I reason in this situation? How do I behave? What's expected of me? I didn't learn that. I was not exposed to that way. So that, for example, for social anxiety, if this child was not able to interact well, and also with adverse childhood experiences, if was there bullying, was there body shaming, was there the constant fights that demeaned the esteem of this child, and if that was not corrected, it's carried on to adulthood. So that you get someone who maybe is in senior management, you expect them to be able to speak to people, and then they get a chance to speak to people in the office, and they just can't talk. And then, of course, they get ridiculed by the staff, and they know that, so then they react in a certain way. So it becomes a very maladaptive coping style. So those two, nature and nurture, how you were born and where you were born. Yes.
Okay. All right. And what about, now let's talk about the coping mechanism, because I can see our time is far much spent. In terms of the coping mechanism, the healthy way, because earlier on I think we mentioned something to do with unhealthy coping mechanism where people might resort to either alcohol or drugs or any other thing just to help them cope. But of course that is not healthy. So how best, because someone might be watching us right now, they have an anxiety disorder, don't know how to handle it, don't know how to manage it. What is the best, not even the best, what is the healthiest way for someone with an anxiety disorder to cope?
So maybe a simple answer to that question is a healthy coping mechanism is one that does not give you other side effects. For example, if you're trying to cope with alcohol to go through an anxious state, that alcohol will have its own side effects thereafter. So what would be some of the most healthy coping mechanisms that have minimal damage to you? And one of the simplest, and maybe Akinyi, if she's still watching, can practice this as we talk, something as simple as a breathing exercise. And we've had these over and over again, and most people say, I've tried these and it hasn't worked. So what we recommend is that if you notice that you're very nervous about a certain situation and you're breathing very fast and very quickly, I mean very fast and very shallow, you're not getting enough oxygen into your lungs to be pushed into the brain. What we recommend is try and notice how you're breathing. For example, even for Akinyi, she can practice this as we talk. Try and notice how you're breathing. You've said that you're shaking. So how is your breathing? Are you breathing shallowly and very quickly? So when you notice that kind of breathing, and there are different exercises that could work for different people. So with the breathing exercise, what we recommend, if you're able to do this exercise, to breathe in deeply and actually see if your stomach can bulge when you breathe in.
Okay.
And then you breathe in with your nostrils and then breathe out with your mouth. And produce the sound. So we recommend that you can breathe in slowly, hold for about 3 seconds, and then breathe out.
Okay.
So breathe in, and even for those who are preparing for an interview and maybe there's a Brew TV that is on a screen somewhere and you can hear this, or an event that you plan to do. So try that, to breathe in and hold it and then breathe out. And the mechanism of action for that is you're pushing in a lot of oxygen into your lungs that gets into the blood and goes to the brain. So that helps to clear off the brain. So that's one. Second one is using your senses again. Try wherever you are in that space that you're in to look for specific things. Like, for example, one color and for example, in this space, we can look for items that are colored in red and to count them. So you can see there's a book there, there's the colors behind us, your dress, the items on the desk. So to focus on those things. So what does to the brain is that it disconnects you from these anxiety-provoking thoughts to focus on other things. So count as many of these items as you can, and then shift to a different color and shift. By the time you come back to yourself, the anxiety is gone or has dissipated. So that's the second. The last one is using your hearing. To try sit and listen. If you're not able to sit still, but just as comfortably as you can, and try use your ears. Listen to sounds that are within your immediate environment and try to identify them. So for example, when I sit here, I can hear some drone in the background and I think it's the AC. And to listen for the very minute of sounds. So for example, you can hear something above us. It's the very minute of sounds and try focus all your attention there. And then switch it. So that if you're in a room, block out all the sounds in the room and listen to the sounds outside of the room.
Okay.
So that if it's raining outside, if there are birds, and you'll be surprised the kind of awareness that you're going to get. Maybe there are birds around this building that you've never heard of. But then when you switch out of here and switch on outside, you're able to interact with your external environment. So that gets the brain to focus on something long enough for it to disconnect with what you're worrying about right now. So those are the basic healthy coping mechanisms right now. Some people find it very helpful to even count backwards. And you can try a big number that is complicated, like 1,000 counting backwards. So, and up to until you feel the relief. If you get to 0 and there's nothing, go to 1 million. And try focus on that and focus all your attention on that. By the time you come down, the mechanism, the physiological reactions that are happening in your body have not been triggered. The triggers have reduced. So they've also calmed themselves down. So you can try that and then give us some feedback.
Okay, all right. And what about those people who need medical, let's say, treatment options to also help with, manage and calm down? What are some of the options for them?
Okay, so the examples I've given is for right now, for the viewer listening. You see, this is, if this is something that, again, the criteria, the frequency and the duration and the intensity, if this is something that you constantly find yourself trying to calm yourself down, constantly, it might help for you to get some help. So the treatment options, or depending on how severe they are, for some people they might need medication for the brain to reorganize. For others, just talk therapy helps. And with psychotherapy, there are very many options that the therapist and the client can agree on. Because one treatment option, even in therapy, might not work with someone, but then might be very effective with someone else. So you can go through those treatment options with the therapist and come up with what's most appropriate. We, however, find that for most people, the response, the recovery is much more effective if they needed the medication and they take the medication as prescribed. Don't change the prescription. And also they stay in therapy so that you learn in therapy. So when you're taking the medication is acting on the brain. And when you speak to a professional, then you look at what are these things in your environment that you're not able to cope with and what can you retrain yourself to do so that you quit the unhealthy or adjust the unhealthy coping mechanism and adopt more healthy coping mechanisms so that you begin to feel more in charge, more able to do those things that you're avoiding to do because of the anxiety. So there is hope.
All right.
And there are very good outcomes for those people who can access treatment.
Okay. And I think the biggest fear for most people is, fine, after I go through, therapy sessions and medications and all that, will it recur? Will I have cases where there's that, repeated episodes of the same, or a recurrence of the same?
Yes. And I'll say yes with caution. If it's well treated, you recover, but you remain in the same environment. So that, for example, if it's an abusive relationship that triggers your anxiety, and nothing changes in that relationship, then of course it will re-trigger you to go back, because you need to cope. You need to survive in that environment. So it becomes something that you constantly have to keep doing to stay healthy. So we always recommend, while you're in therapy, are you able to be intentional about changing your environment, and so that you don't become a victim of the same environment? You're proactively altering the things in your environment that are affecting your, if, for example, it's a communication style with your partner or with your child, or that is the thing that is causing you to have anxiety. Are you able to come in with your partner so that we talk about how does this lead to this, to this, and how can you even support your partner who's in for treatment in the anxiety, or how can the family support you? So treating a patient in isolation, especially with mental illness, is not always recommended, especially if they're living with a family or they're living with someone else, so that you give information, what we call psychoeducation, to these parties, so they know this is how I can contribute to this situation getting worse, or this is how I can contribute to this situation getting better.
Okay. All right. And what about those people who, and I think this is something for all of us, most people don't embrace therapy, counseling, see a psychiatrist and all that. And of course, from the latest report that came in earlier on today, people are talking about it. That is, of course, cases of depression in the country. People don't talk about those things. So, and especially for a person with an anxiety disorder, what could happen if this person either delays seeking treatment or doesn't seek treatment at all, either in form of therapy or taking their medication?
Well, there's a lot of information out there about people not seeking therapy because there's a huge stigma attached to it. There's also very positive reports that maybe we don't talk a lot about them, of the increasing number of our people who are seeking this help. And the demography of the demographics of this population is that they are most of the time either being mandated by the institution, the workplace, the school, or the family, or two, they willingly come. And we get so happy when we receive someone who's willingly come on their own volition because they feel there's something that is not okay. And these are very good indicators for even this person getting better, that they are ready and willing to receive therapy. There are those who come to test, to see, does this thing work? Is it how it is in the movies? Does it mean that therapists see people who have gone crazy? So there's a lot of misinformation out there. And what we like to suggest to even the viewer listening right now is that it's a conversation. It's a conversation we are having, but it's what you call a clinical conversation. So it's a conversation that you'll have with any other person, only that this is a professional conversation that is meant to understand you and then make suggest treatment options and help you to get away from what it is that you're suffering from, or to manage or to heal from what is going on with you. So we understand there's a lot of stigma attached to it. It's only us who can break that stigma. So that if you have a friend who's telling you, no, you can't go to therapy, that's a first world problem, you shouldn't just talk. But we talked about this, talk to your mom, talk to your dad. It helps to have this person still pursue, because you see, you're responsible for your own health. And you can even come in anonymously to just check to see, this is how I've been feeling, are there treatment options? I always love to give this example, maybe finally, that if you're in a road accident or if you fell down the stairs and you broke your leg and it was bleeding, you won't go back to the house and lie and say, oh, I'm going to wait it to heal. You'll quickly get an ambulance or call a friend and go to hospital because you know what to expect. And you know that you don't want to bleed to death. When it comes to mental health, people tend not to prioritize it. And yet think about it. Anything affecting your brain the brain is where everything
True.
originates from. So if there's something affecting your ability to function, how you see yourself, how you see your world, shouldn't that be a very important thing for you to prioritize over everything else?
Okay.
Yeah.
All right. Our time is far much spent. We have to end the show right now. But of course, this is a conversation that we need to keep. We are talking about every day. And even after the show, of course, we can still talk about it. And that is by sending, people can still send in their questions via our SMS line 40975. And of course, we'll forward them to Arthur. And of course, he will be able to answer all your questions. But all the same, thank you so much for coming. Over today, and of course helping us understand more on anxiety disorders. And like I said, this is something that we don't really talk about it, but it's important that we talk about it. So thank you very much, Arthur. And of course, thank you so much for staying with us until the end of the show. My name is Winnie Lubembe. On behalf of the entire team who made the show a success, we wish you a lovely day ahead, and then we'll see you tomorrow, same time, same place. That is on My Doctor for another episode of the same. But for now, it's a goodbye from us. Have yourselves a lovely day ahead and a prosperous month as well. Goodbye for now.